Hello, everyone. Welcome to this special edition of our Preemie Chat. My name is Fabiana Bacchini. I'm the Executive Director of the Canadian Premature Babies Foundation. CPBF is a charitable organization, and we provide support and education for families of premature babies. Every Friday at 1 p.m. Eastern Time, we have live sessions with experts from around the world. This coming Friday, we'll talk about breast milk and breastfeeding, as this is the World Breastfeeding Week. Join us live at 1 p.m. on a live streaming discussing NEC, human milk banks, and what is new in research around breast milk. And right now, as many of you have seen on the news last week, there is a surge in RSV cases in some countries, including US. And many families have asked us what is happening in Canada and how can we protect our premature babies. To answer your questions, we have invited Marianne Bracht to join us here today. Let me bring her to the stream here. And Marianne has 43 years of experience in nursing in neonatology as a bedside nurse in the Neonatal follow-up clinic. She was an NICU parent resource nurse, as well as the RSV nurse coordinator in the NICU at Mount Sinai Hospital. She has retired, but is still very active member of the Family Integrated Care Committee, as well as the chair of the education committee here at CPBF. Marianne, welcome. Thank you for joining us here tonight, live from Toronto.
Can't hear you.
Oh, you can hear me? Can you hear me now? Marianne, can you hear me? Oh, I think Marianne cannot hear me. Okay, Marianne. Okay, we are going to take a short break. We'll be back in 1 minute. Let me figure out this audio issue with Marianne. Hi, can you hear me now?
Yes, I can hear you, but I can't see you.
Okay, but you can, if you can hear me, that's good. So let's go back live.
Yeah, I can hear you.
Okay, sorry everyone, Marianne is back here to talk about RSV. We had a little bit of a technical difficulty. Marianne, we talk about what is happening in Canada in terms of RSV, because we've seen the trend in US, we saw the trend in Australia earlier this year. So what is happening in Canada right now? Any case of RSV so far?
No, not really. I think it's being closely monitored and we aren't seeing a surge or an increase at this time of year yet. But there is a concern because, as you said, they saw it in Australia, they've seen it in South Africa, the UK as well, and currently in the southern states. So it is a concern.
There is a concern. So let's, for the new parents who are listening to us today, let's first talk about what is RSV and why parents of premature babies should be concerned about this virus.
Okay, so RSV stands for Respiratory Syncytial Virus, and it's a very common virus, especially in children and infants and toddlers, especially children under 5 years of age. And it sort of shows itself as a common cold, sort of sniffles, a little bit of a cough. Maybe the babies don't want to eat, but the concern is for those infants that were born prematurely and those infants that have had medical complications at birth, especially under 6 years of age.
So let's talk about why those babies are more vulnerable to this virus, why they are at a higher risk.
Okay. So the preterm baby, when they're born early, their lungs are immature, and the immune system, so the system that protects you, is immature. So until they start to build their lungs, develop their lungs more, and their immune system starts to build up, they are at risk. And what they're at risk for is, yes, to maybe get the RSV cold, but it could become bronchitis. And bronchitis can be quite serious in that babies end up with congestion or inflammation in the air pipe or the wind, in the bronchioles or the little air sacs. And that's what the worry is.
So can we talk a little bit about how term babies have the immunity passed on from moms to the babies while they are pregnant, and why we lose that with the preterm babies? Because I think we have actually a very good visual on our website, but I will share here the link of this infographic that really show the lungs. But Marianne, let's talk about it, because I think it's a very important information for new parents.
Okay, so what happens is the moms make antibodies, they get transferred through the placenta, and when a full-term baby is born, they have the full complement of the mom's antibodies to start protecting them. But when a premature baby is born, and that is babies less than 36 weeks gestation, so even a baby that's born at 35 weeks gestation can be at risk as well. They don't have as many antibodies transferred through the placenta to the baby. And especially babies that are less than 32 weeks gestation all the way down to 24 weeks, 23 weeks. So what happens there, when they actually go home, they don't have the same kind of protection that a full-term baby has. And they need to start working to build that up. And that takes a little bit of time, especially in the first 6 months of age, all the way up to 1 year.
So Marianne, the term babies up to 2 years old, is a common knowledge that a lot of those babies have RSV, but show up as a cold. And parents do not have knowledge of RSV, as we show in our survey last year about RSV. So we don't really know what RSV is. So for parents who have term babies and now they have preterm babies, how can they protect the preterm babies or decrease the risk of infection?
Okay, so the interesting thing, what happened last winter is they had very, very little RSV infections in Canada. And that was because of the masking, the social distancing, the increased hand washing, as well in some provinces, siblings were not in daycare or in kindergarten and school. So it was easy to keep those little babies safe during the winter. So with the changes in COVID in terms of how what they're saying in terms of, you can now go out, you don't have to wear masks anymore, this kind of thing. That's the concern that people have, in that we won't be doing the same things that we were doing to reduce the risk of infection. So I'm going to say to all families, what's extremely important is you need to continue to wash your hands. And you need to make sure that if anybody sick in your family or friends or relatives are sick, the babies really should stay away from these people as much as possible. Now, I know there are families that have siblings in the home, and it's important for the siblings to go out. It's important for moms and dads to take their babies out as well. What we want you to do is to try and keep that baby away from sick people, because we don't know if it's an RSV virus. We only find out it's an RSV virus if the baby goes to hospital and they do a nose swab, and that's when they find out whether it's that virus or not.
So let's talk about that. What symptoms parents should look for? Okay,
so RSV is a common cold. You have a runny nose, you may have runny eyes, you may not feel very well. This is for children. This is for children under the age of 2. But for babies who are less than a year, babies less than 6 months of age, we've talked about the immature lungs and the immature immune system. What can happen is that RSV cold can turn to bronchitis. And bronchitis is extremely serious. And what can happen there is the babies can have difficulty with breathing. They will have coughing, they will have difficulty feeding, so they may end up with not peeing very well. So it's extremely important, if you're worried about your baby at any time at all, is to call the baby's doctor. If your baby's having breathing difficulties, or has blueness around the lips or wheezing at all, you must call 911, and the baby probably should go to hospital to receive a little bit of oxygen.
Yes.
But if your baby is feeding well and smiling at you and having a few sneezes and eating well, your baby's probably fine. But I always recommend that if you're concerned, to call the doctor. What we are concerned about is that babies could have breathing difficulties.
Absolutely. And I think, and I see parents are very aware of that, and also very aware, even before COVID, we were very well trained on washing hands and keeping the babies away from sick people. I do not go to crowded malls. And I remember really well because we were discharged in October, and I knew we had to have hand sanitizer around the house and minimize the number of visitors. Actually, we had no visitors in the house. So COVID for us came at no surprise on what we need to do, because we're pretty much prepared for that. But at this time, Marianne, the symptoms of RSV look very similar to what we hear about COVID symptoms. And as you said, that parents are concerned, no hesitation to call the doctor and go for a swab and make sure it is RSV or it's not RSV. But let's talk about if the baby does have RSV, what are the long-term consequences of RSV? Parents should be concerned, and then we can talk a little bit more about the injections that we have here in Canada.
Okay, so if a baby gets an RSV cold, and they're eating and they're smiling and they're sneezing a little bit, it could be RSV, but maybe they're doing just fine. And there's probably no consequences there. The problem is that RSV gets worse and the virus gets into the airways, as I said, and causes bronchitis. And that's what parents have to be very, very careful about. And I think one of the things that is really important to remember, as you mentioned, you went home and you didn't go out, or you went out as little as possible. You went out for walks, and that's extremely important. It's important to see grandparents. It's important to do those kinds of things. But what generally people pre-COVID didn't understand was how serious RSV could be to a baby born prematurely. I think knowing now how we know about COVID and social distancing, I think those are the things that we need to continue. You need to continue. If you have a small baby at home and a grandparent says they have a little bit of a sniffle, they should stay away. And so those are the things that I think society has a better handle on. And the other thing is they do think that RSV is going to come back with a surge, because what happened last winter, there wasn't any RSV. It was very, very minimal in Canada. So pregnant moms didn't have any colds, so they didn't build up any antibodies. All our children weren't in daycare, or they were very rarely sick. So they really feel it's possible that this may come back differently because we don't have the same antibody protection that we had last year. So this is something that I think we have to continue, even though they are relaxing on some of the COVID recommendations and decreasing the risk. I think we still have to keep social distancing. We have to wash our hands, but we have to get out and we have to be about, but we have to be safe about it.
Absolutely. Marianne, let's talk about the RSV prophylaxis, because in Canada we have this program. Actually, almost every country has this program, but Canada has a really established program for RSV prophylaxis. Let's talk a little bit about that for the parents who are here for the first time, perhaps going to be their first fall, winter season. So let's explain to them what is this program, and how they know if their baby are eligible for the injections.
Okay, so what you're talking about is something called RSV prophylaxis, and it is an antibody, and it is given to babies who are extremely high risk of getting bronchitis as a result of RSV. The criteria for which babies qualify depends on where you live in Canada. So it's extremely important to speak to your baby's doctor, to speak to the neonatologist as to whether your babies qualify or they don't qualify for this particular prophylaxis. If your baby qualifies, and generally extremely premature babies all do, it's very, very important. It's a monthly injection, and you must continue to go, even though your baby is healthy and your baby's feeding well and is not having any coughs or sniffles. The purpose of this antibody is to try and protect your baby from not going into the hospital. And that's really important. So it's almost similar to the vaccine in a way, because your baby could get a little bit of a cold, but we want to keep your baby out of the hospital. So you must go. These injections are monthly. So the babies that qualify, they need to go monthly for the injections. Generally, it started in November, and they stop giving it in March or April. The RSV cold virus comes around the fall, beginning of November. It goes through the winter, and then it continues until about spring. It is always around. It is around all year, but not to the same degree as it is in the winter months.
So yeah, so what you're seeing in US right now is not typical of.
It's not.
It is not typical.
It's not typical in the UK either, or in South Africa where they've seen it. You're right.
Absolutely. So I'm sharing the CPBF website here, and under common inter-illnesses, we have the eligibility criteria by province. And obviously, if families have a question, they can always ask their own doctor. But we have a little bit of the criteria there by province, so families have a general idea whether their babies are eligible or not. But Marianne, I want to thank you so much for joining us here today. I think.
Can I say one more thing very quickly?
Absolutely.
To protect your babies, to continue to protect your babies over and above the hand washing and social distancing, is please make sure they get their vaccinations. It's absolutely imperative that all babies get their vaccinations, but the premature infant, absolutely, they need to follow, and you need to follow the guidelines of the 2, 4, and 6 months and not skip those appointments. And we also recommend that family members get the flu shot this coming winter, because the flu may come back differently as well, because we did such a good job of social distancing and hand washing last year. It could be the same problem. So all family members, grandparents, everybody, we recommend they get the flu shot, and any baby 6 months and age or over should get the flu shot as well. Please speak to your doctors about it.
Thank you so much, Marianne. Thank you so much for joining us here today. And I know you will be back to our live sessions in October to really unpack more about RSV and how to decrease the risk of infections during the winter months. But thank you so much for today.
Thank you for asking me to be here today. Thank you.
And for all of you watching us live on YouTube or Facebook, thank you so much for joining us here today. The video of today's sessions and all the other videos from our live series are available on our website. I will share here the link, canadianpreemies.org. And we are a charitable organization, and we believe that through education and support, we can empower families, ensure they are ready to care for their premature babies. Please visit our website, consider making a donation. Together, we can create a brighter future for all our families. And this coming Friday, we're going to have a special live session. Let me share the link here. Starting 1 p.m. Eastern Time, because it's World Breastfeeding Week, and we're bringing experts from around the world to share their latest research and the latest findings on breast milk. So joining us here live on Facebook or our YouTube channel. So stay well, everyone, and I see you next time. Thank you.